back to our webcast. This is a part 2 video. So if you haven't watched the part 1, we were talking about contraceptives with a very lovely, very beautiful, brilliant, informative Dr. Kristina Sule. So if you haven't checked that out yet, please check it out. And today, as we dive into today's episode, we'll be speaking about feminine hygiene hacks. This is something that is really personal and varied from woman to woman. So even as we speak about it, I'd like us to know that we are speaking from our own point of view, and of course with a professional point of view also. So, but yeah, this is varied from person to person. So take what you will.
Hi everyone, my name is Dr. Kristina Sule, and I'm a consultant obstetrician and a general and cosmetic gynecologist at Alora Medical Practice, my private practice. And thank you so much, ladies, for having me. I really appreciate it.
Thank you for coming.
And so feminine hygiene has a lot of influences in culture, in religion, in personal beliefs, in personal preferences. There are a few hard and fast rules, but there are some that are, kind of open to discussion and open to preferences. We do have a few do's and don'ts, and I think I'll just get straight into them. So some do's are how, for example, we wash. So use water, right? Do not add antiseptics, creams, over-the-counter products and substances. Just use plain water. You can use your bath soap, right? You can use a vaginal wash, and sometimes I wonder why they're called vaginal washes, because they're actually not supposed to be used inside the vagina. They're supposed to be used on the outside only, right? The other do is use your hand. Like don't try not to use a loofah or a sponge or a face towel when you're cleaning your external vulval area. You can use it for the rest of your body, but use your hand for that. If you choose to use a vaginal wash, as I mentioned, again, use it on the outside. There are some people who prefer to use them only when they're having a period, or maybe when they're having an abnormal discharge and they're on treatment for that, and they just want to use a wash at that time. There are some who prefer to use it daily. There's no rule for that. You can kind of use it whenever it is that you like. Just do not insert inside the vagina. Wear cotton underwear preferably, or silk. Underwear that is polyester, can be worn, but the area that comes into direct contact with the genitals should be cotton, and that's very important because polyester tends to trap heat in a very strange manner. It retains heat, it retains moisture, and that can predispose us to getting infections. So a lot about feminine hygiene has to do with balancing the good and the bad microbiology in our vulval area. So we do have, for example, good and bad organisms, good normal flora and infective bacteria, fungi, and protozoa, and the point is to maintain a balance. When the bad ones outweigh the good ones is when we get an infection. And remember, the skin around our vulval area is not like the skin we have on our hands or anywhere else in our body. It can be penetrated easily by infection. It retains more heat, it produces more moisture, it has more sweat glands, it has more secretion, so it's very sensitive to this kind of thing. So our point is to be able to maintain it dry. So that's one of the do's. Ensure that you dry yourself well after showering. Wear cotton underwear. I think I'm going to have to mix the do's and the don'ts, because I'm already thinking of like 5 don'ts in my head. And one of the don'ts is don't wear underwear at night, as weird as it sounds.
Oh my goodness, I've been telling people.
So it's good to sleep without underwear. It's much healthier, because it's bad enough that we have to trap all that heat and sweat and everything during the day, and now you want to trap it again during the night. So that's 24 hours of your skin being unable to breathe. And so do not sleep with an underwear on.
So would you advise, there's these pearls that people insert, and they come out if you've watched the videos,
with toxins and stuff.
Okay.
And I'm like, oh, that was in your body?
I have. So yeah, that was not in your body. So just to clear that up to start with, I have like an aversion for yoni pearls and products of any kind.
Yes.
So my issue is this, yeah. First of all, whenever you use a product, you need to know why you're using it. Yeah, what is the purpose of you using it? Are you know, using it to cleanse? Because many of them advertise in a manner to say you're cleansing your womb, you're cleansing your vagina. Now, your vagina or womb do not need any form of cleansing. The vagina has a system where it cleanses itself. The cells of the surface get shed and they come out in your discharge, and new cells get formed even before 24 hours are over. All right, and it happens very quickly and it's very efficient. It's the same way you don't need to cleanse your mouth other than brushing. You don't need to remove all the cells of your cheeks and teeth and tongue and all that. You don't need to do that. It cleanses itself through the saliva, and well, fortunately or unfortunately, we swallow it and new cells are formed, right? So that's the same way the vagina does not need cleansing. So there's no cleansing that you're doing there. Now, in terms of fertility, the products that are in yoni products, nobody knows what they contain. Nobody knows the content of that product. So we don't know whether it's causing fertility or infertility. So many of them says, oh, I started using yoni products and then I got pregnant. Well, frankly, that was just either coincidence or God. It was not because of the yoni product. I can say that with utmost sureness. And I know that there's no gynecologist out there who is promoting yoni products. So if anything, that you need to ask your medical professional, like, is this something that I should do? Is this something that's good for me? Now, the other thing is that people claim that they cause vaginal tightness. Now, there's safer, medically proven ways of causing tightness. And what they actually do is they cause dryness, and then people confuse dryness for tightness. Dryness is not tightness. You can be extremely dry and think that you're tight because of all the pain and the discomfort that you're experiencing during sex. That is not tightness, it is simply dryness. And the sooner we figure that out, the better for all of us. Now, the reason why I'm so against the products as well is because of the adverse effects that some women have gotten. And these are just some that I've seen in my office. I'm not able to like scientifically document, but I've seen people come in like, oh, I use this product and now I have this. And so when you observe, some of them develop scaling in the vaginal walls, like dryness, like literally scaling like a fish. I'm telling you, like the things that I've seen. And the worst thing is that we sometimes don't even know where to begin the treatment from because we don't know what was contained in the product. Sometimes people put them in and they're unable to remove them. They either get stuck or forgotten, and then they get terrible infections. Sometimes they put a product and it kind of erodes the surface of the vagina to the point that it forms a small, almost hole, and it eats through the tissues of the vagina. And the reason it's doing that is because you don't know what was in it. Maybe there was some acid, maybe there was estrogen, maybe like nobody knows what was in it. And so I totally do not recommend them. As I mentioned, the vagina doesn't need any cleansing. Even as I'm telling you how to wash, I'm telling you do not wash inside the vagina because it does not need washing inside. Another don't is douching. Please don't do douching. So when you get those douches where they tell you like you need to spray something into the vagina, do not do that. That's not necessary, either for medical reasons or even just for daily hygiene. Do not do that. Do not use talcum powders. So many women think that, you know, to be able to maintain dryness, I'm going to use a powder. Don't do that. Talcum powders can predispose you to ovarian cancer. All right. Yes.
Isn't talcum powder the one for the yeast infection for the feet?
So you can get that's an antifungal powder, but it's in a powder form. Yes. So they'll put the antifungal into the talcum powder, and then it's for the feet. So some women just use even just baby powder, right? As in, like, people should not use like consistently, you know, for several years to maintain dryness. Like, try and maintain dryness by drying yourself, using a cotton, you know, underwear and things like that. I don't know if I can remember. So of course, you know, change your pads frequently or your tampons. That's part of hygiene as well. Because, you know, when you get tampon use for very long, it's very easy to get toxic shock syndrome. When you don't change your pad frequently enough, you can get a dermatitis because now there's heat, moisture and blood on the surface of the skin, and it's constant. It's been there maybe 6-8 hours, so it can predispose you to getting a skin infection. What else?
How common is toxic shock syndrome?
Frankly, it's not very common. I've personally never treated a patient with toxic shock syndrome. However, I always feel like if the manufacturer of a product tells you something about it, please, they know why they're saying that. So if the manufacturer of tampon says, look, you can't get toxic shock syndrome, then, and of course it is described in medical literature. I've just never treated anyone with it. Yeah. Maybe because my patients are diligent in changing their tampons.
That's right.
Yeah. I don't know what else.
I
can
wanted
talk
to
about.
ask, do you recommend salt baths?
No, I don't recommend salt baths. For any reason. Okay, why would first of all someone do a salt bath?
To cleanse, to like people say it balances like your pH.
No. Actually, vaginal washes have an already established balanced pH, so that's a good thing. If you want to balance your pH, you can use a vaginal wash. I would say do not use salt baths, and this is the reason. Not because there's anything wrong with salt or hot water, but because when you use a bath, when you use any kind of a bath, the water at the surface of your skin will be stagnant. So it's always better to take a shower than a bath. I mean, of course, sometimes you can have like a bubble bath once in a while, but don't make that your daily ritual, because we need running water on the surface of our skin to be able to remove all the impurities. Now, when water is stagnant, whether it's salt water or has whatever in it, it just sits on the surface of the skin and it doesn't cleanse the skin in any way. It doesn't remove the impurities. You need running water for that. Yeah, so that's my only reason for it.
You mentioned pH when it comes to the vaginal washes. So what's the specific pH that's healthy for the
Vagina.
vagina?
So the vagina generally has an acidic pH, and then we have these flora in the vagina, the normal flora. They're called lactobacilli. So an acidic based wash or an acidic based pH. So when you're producing a vaginal wash, you have to, like the FDA ensures that you make it acidic already. So it's very difficult for you to produce a wash and say this is going to be a vaginal wash and yet it's basic. So the pH is generally acidic. Of course, we're not going around with our litmus paper and like, I'm going to test the pH of my vagina. It doesn't work like that. But generally, an acidic pH is what is more favorable. And maybe because of that is why people in culture, were more like, use lemon to cleanse the vagina. You shouldn't do that because lemon pH is much lower, very acidic for the vagina. But our general vaginal pH is acidic, which is why the good bacteria in the vagina, the lactobacilli, thrive very well in that acidic environment.
And maybe that's why we're also culturally, or I don't know, we've been told not to use soap on our vagina. Maybe
because it's basic.
Because soap is basic. So.
Okay.
And then, like for the people, because I've seen so many people, so many girls actually, who say that like when you take certain fruits, your vagina tastes better or something. But then, like, is that really something that's true, or is it just a myth that's going around?
It's actually not a myth. The food that we eat does affect our vaginal discharge in terms of pH, in terms of smell, even in terms of texture, which is why when you have a yeast infection, you're encouraged to eat more yogurt because it has a lot of lactobacilli and that will improve, your infection. As to the taste, really, I cannot comment to as the
No
taste.
pineapple?
But I've heard of that as well. However, I do assure you that the food that we eat does affect the kind of vaginal secretions that we have.
So if you eat
And also
more
water.
like maybe acidic fruits like oranges, pineapples, lemon, your pH would definitely be balanced.
So I don't know if it's a direct effect on like I eat an acidic fruit, it makes it directly acidic. I don't think it works like that. But what I do know is that when we consume dairy and things that have lactobacilli, then with time your vaginal secretions will produce more lactobacilli. It's not a direct like I've eaten an orange now all of a sudden I'm acidic down there. It doesn't work like that.
But over time.
And also I don't know if it's a direct cause. You generally have to maintain a healthy diet. For example, if your immunity is low, you can eat all the oranges in the world, but that will not change your vaginal secretions. You'll still be more prone to infections. You'll still be more prone to warts, to HPV, to getting all sorts of infections. So just watch your diet. I can't tell you eat this for this pH. It's not a direct science, but yes, watch your diet. And the yogurt thing has, that's been proven. Like if you consume more yogurt, of course you will still need to treat an infection. Like if you have a yeast infection, you have to get medication for it. You can eat 3 liters of yogurt and you'll still be unwell. But as you are getting treated, if you consume more of those products, then your infection and your treatment will be faster and better.
I've also heard of people using natural yogurt and
or like coconut oil to like treat lifting.
I would not advise that.
Shit,
I
I've
would
had
not
them
advise insertion of anything that's not a medical product. Even application, I would not advise that. Like, don't apply yogurt. If you have, like an infection, don't apply coconut oil. I've heard of people using, like coconut oil to induce labor. Yes.
Okay.
Yes, or castor oil to induce labor. Some people apply it, some people drink it. But in terms of an infection, you see, the problem is this. When we get an infection, there are certain things that we do called cultures. So we take a part of your smear, we put it in a culture medium, and we see which bacteria will grow there. Now, the culture medium is basically food for the bacteria. We see if we provide this bacteria with food, oxygen, and everything, will they grow, and which ones will grow. Now, when you take coconut oil and when you take yogurt and you take all those things and you start applying, you are literally feeding the bacteria that are there and making them multiply and spread and grow. So do not apply any food products, please, in your genital areas. Do not insert anything of the sort. Medical products only.
So, like, what should someone look out for to like know something is off down there and like you need to like get to a doctor?
Okay, that's a really good question. With time, you always know what your vaginal discharge looks like, and everybody's is different. For some, the color is a bit lighter, some the color is a bit darker. So basically, this is what I say: if your vaginal discharge does not have an odd smell, and by odd I mean like fishy or something rotting and all that, because we all do have a smell, and it's not it's not at an odorless area. We do all have a smell, but it's something that's not foul, right? So if you develop a foul discharge, like something that's fishy or rotten, just foul smelling, or if you develop any kind of irritation, itching, a burning sensation, pain, or if your discharge develops a color that's not usual, like for example, not white, not cream, no shading between, maybe it has blood, or maybe it's green, or it's black or something like that, then now you can seek medical attention. So when your discharge changes in terms of odor, color, and a burning or itching sensation, then you should probably see a gynecologist for that. Because I usually do get a lot of patients coming and saying, oh, now it's cream and it used to be white, but it has no other symptoms. Or maybe it used to be very little and now it's the same color, same smell, same textures, no burning sensation, but now there's a lot more of it. That's actually normal, because as our estrogen and progesterone fluctuates, the thickness and amount of our discharge also changes. So if it's more runny or it's more in amount, you shouldn't be worried, as long as it doesn't smell bad, is not itching, doesn't have a strange color.
There's actually two questions. One was whether like if it's creamy, if there's a creamy discharge, if it's bad, and the other was like if it like increases or it's less like runny and more thick, if it's thicker or runny. So
that's not a problem at all. The more progesterone we have, the thicker our discharge is. The more estrogen we have, the runnier it is.
Okay. I think it's important even for like younger girls to know that your vagina is supposed to smell like a vagina, because they want it to smell like flowers,
Allah, Allah, Allah.
like fruits, like perfume. Don't spray your vagina.
there's like vaginal
like sprays and stuff.
there is.
There is. Yeah. So you've had it,
So like when you go to the gyna, what kind of tests? Okay, I guess I'm just trying to allude to pap smear, but like what kind of tests how do you check for like feminine hygiene gone bad?
Okay, so most of the time I would advise people to see a gyna when they have an abnormal discharge. If your discharge is normal and you've done your annual pap smear, you've done your breast ultrasound, you've had your HPV vaccine, there's really no need to see a gyna for anything. But if your discharge does become abnormal, your gyna will examine you. Some of them may choose to just give you broad spectrum treatment because they already know what's going on because they've seen it a number of times. But if it keeps recurring or if they're not sure of what they're dealing with, There's some tests that they can do. There's one called the high vaginal swab, which is where we take a small sample of your abnormal discharge and we test it. We see what bacteria does it have, what protozoa, what fungi does it have. We keep it in the lab for about 2 to 3 days. We see what's gonna grow on it. That's one of them. You can also do an STI screen. You can test for chlamydia, you can test for gonorrhea. They might decide to probably do a HIV test for you, or a syphilis test, or a group B strep test. There's a number of bacteria that are responsible for STIs, and your gynecologist may decide to do that. And then once they have the result, then they give you and your partner treatment. Yeah, so it may not necessarily just be for you. There are times it can be for you only. But if they do discover an STI, of course they'll want to treat your partner. Ideally, pap smears are not done when you have abnormal discharge or when you have your period. So once all that is clear and sorted, so that usually takes about a week to 2. Then if you don't have your period, you can come back in and they'll probably do a pap smear just to see whether the cells of your cervix are normal. If you're over 30, they'll do a HPV test for you as well to see whether you have HPV or not. And then they'll let you know if the cells of the cervix are normal, whether you have HPV or not, and if you have HPV, which strain do you have, because there's over 200 strains. They'll let you know whether you have the ones that are high risk for cervical cancer or the ones that are low risk or none at all. And the reason why it's important to do a pap smear is because the fact that you have an STI means that you were having unprotected sex, and that could have predisposed you to acquiring a HPV infection. So when you have HPV, HPV is the major cause of cervical cancer. So it's very important to catch it early to see whether you have it or not. And also if the cells have already started becoming abnormal, there's treatment for that as well. And if you don't have HPV and you've recently had an STI, then it would be good to get the HPV vaccine at that time.
Is there an age limit to the HPV vaccine?
Yes, there is. We give it between the ages of 9 and 45. So if you're under 9 or over 45, then you should not have it. The best efficacy for the HPV vaccine is under 26, but it still works extremely well even after 26. It still works extremely well and over 26, and we do give it up to the age of 45. The efficacy under 26, if you've never had HPV, is about 99%. If you're over 26 and you've previously had an episode of HPV, or you previously had an abnormal pap smear, the efficacy is still up to 65 to 75%. So it's still a very important vaccine to get. It's the only vaccine for any cancer that's available. So it's very important.
And how much does it go?
So it can range anything. Okay, so there's many kinds of HPV vaccines. First of all, we have, as I mentioned, there are many subtypes of HPV. There are about 14 high-risk subtypes. So we have a vaccine that protects against 2 of those subtypes, and they are the most notorious for causing cervical cancer. Then we have another one that protects against 6, and another one that protects against 9. Now, with a cost-benefit analysis, it makes more sense to do the 1 for 2 because those are the most aggressive ones, and you've protected yourself against the ones that are most likely to cause cervical cancer. However, if you do have the money, you can do the one that protects against 6 or 9. Now, the cost for the one that protects against the 2 subtypes, it's called Savarix, by the way, can range anything between 3,500 to 10,000, depending on the facility that you go to. Unfortunately, again, it's not covered by insurance. The one that protects against 9 is actually in very few private facilities, and the cost ranges between 30 and 35,000.
Wow.
35,000.
Feminine health is so expensive.
Yeah, and that's per dose, by the way.
Yeah, and
Wow.
you need 2 doses
You need
of the
3
vaccine.
doses
Oh,
of
no.
the vaccine.
So it's unfair that you'd have, this is 52% of the population needs this kind of help, but you won't insure it.
I saw a poster somewhere that showed that the HPV vaccine is free in government hospitals.
Yeah, actually, so the government has been giving it, I don't know if it's free in government hospitals, but they've been giving it to schools, high schools and primary schools, to both girls and boys, because boys do need to get vaccinated against HPV as well. between the ages of 9 and 15, and I think that's a really good initiative by the government.
Yeah.
However, it's not being taken up very well because of, again, cultural issues, because when you vaccinate a child against HPV, parents feel like you're giving the child permission to
To go
have
have
sex.
sex,
And
yeah.
that's, that doesn't, fly well with them, but that's not the case,
Yeah.
They do need to be vaccinated because you can prevent cervical cancer. And the reason why it's done from 9 is because studies were done all over the world to see at what age are children starting to have sex, because we need to do the vaccine before they have sex. And the average age was coming, the lowest age was coming to about 9, which is why they came up with 9. It was not an arbitrary figure, it was like, this is what is happening, let's go to the lowest possible age, and that's where we'll give the vaccine. So it's very important to get, if the government comes to your child's school and offers the vaccine, please ensure that they have it. It's very safe and it will prevent cervical cancer.
Question number 1. It's not hygiene, but it's like how to get rid of cramps forever.
See your gyna.
See your gyna.
See your gyna
See,
and find
so
out
it's
what the
possible.
problem is.
Oh,
Yes, it depends on what the cause is. Like, for
Yeah.
example, if you're cramping because you have fibroids and you have a surgery to remove your fibroids, then you're done with your cramps, basically, right?
Yeah.
If you have endometriosis and it gets treated, if it can be treated to completion, because sometimes it can't, then there go your cramps. If it's because of hormonal imbalance or whatever, once you get treatment, but you need a diagnosis to be able to know whether it can be treated. There are some diagnoses that you'll find I cannot solve your cramps forever. Yeah.
Okay.
Is it necessary to pee after intercourse?
It's advised. It's advised to pee, just generally because there might be any bacteria or something that may have entered the urinary tract during sexual intercourse, and that would be a way to kind of flush them out. If you do not pee after intercourse, it's not the end of the world. You're not going to get an infection. You probably just need to move on with life. What is necessary is to use a condom. That's more important than peeing after sexual intercourse, but it's kind of one of those, if you do it, that's a good thing. If you don't, it's not a bad thing.
Can I shorten my period?
Yes, in certain situations. You cannot shorten it permanently. So for example, if you are going to travel and you know your period is 7 days, and you want to make it shorter so that at the time you're traveling your period is not as long, there is medication your gynecologist can give you so that your period lasts about 3 to 4 days and not the 7 that it usually lasts. But it's not something that you can do sustainably for the rest of your life, that your period will always be 3 days. That means you'd have to take medication every single month, and the problem is that with the medication we give to control or stop periods, when the medication is stopped, you get something called a breakthrough bleed. So your body then compensates for the not bleeding, and you bleed even more. And so it's something that we'd advise to do once in a while, but not regularly. You cannot make your body go from a 7-day cycle to a 3-day cycle.
So there's like 2 more questions. One is, what's a solution to irregular periods apart from hormonal contraceptives?
Well, it depends on what the cause of the irregular periods is. So if you have irregular periods, you need to see your gynecologist, because irregular periods can be because of hormonal issues. They can be because you have polycystic ovarian disease, for example. They can be because of endometriosis. They can be because of fibroids. There are many causes. And so if the cause is hormonal, if your gynecology tells you because it's a hormonal issue, then the best way to control would be a hormonal contraceptive. Although we do have other medications that can control that are non-hormonal. We do have something called DAN, which is a plant-based kind of hormonal contraception, which many gynecologists like to use. Really, most of the time it's hormonal, but we do have a few options that are non. But what I would emphasize is to try to find the reason for the irregular periods, because the reason may not be hormonal.
And finally, can you wear jeans without panties?
Okay, I don't know why you'd want to wear jeans without panties.
Why?
I don't know why. For me, I always want to know what's the reason.
What was the
Maybe
reason?
to let it breathe.
Yeah.
Breathe and you're wearing jeans.
But you're in jeans. Jeans are not breathable
Breathable.
at all. I can't answer yes or no to this because if you don't wear panties with your jeans once, there's nothing bad that can happen.
Yeah.
But at the same time, if you choose to wear, your underwear with your jeans, there's no necessary benefit. I just say, just wear your underwear. If you choose not to, then it's not because of any medical reason.
I saw, I think it was cartoon comedian or someone on Instagram walikuwa anasema millennials na Gen Z are going to kill the underwear industry vile tulimaliza industry ya kamisi. Do you think
Yeah.
it's true?
It is.
It is. Is it a bad thing though?
The kamisi industry.
No,
being
the
killed.
killing the underwear industry.
But underwear,
But underwear.
I mean, underwear basically is there to. I don't know why people, came up with underwear. I don't know what the history behind it was, but gynecologically, I feel like it's there to collect your discharge. So your discharge is not going directly on your clothes.
Yeah.
And some people have pretty heavy discharge, not because it's abnormal, but that's just how they are.
Yeah.
So underwear does serve a purpose. It does maintain some form of hygiene. If you choose not to wear it because you're wearing a particular outfit, then I do understand. If you're not wearing it at night, that's even recommendable. But I don't understand why not to wear it during the day.
Every day. It's a struggle.
But if you don't wear it with jeans, probably you'll have to wash your jeans after every wear or something.
yeah. Oh, there's one question. It says, how do I control my hormones?
How do you control?
Yeah, hormones. Like, I don't think it's linked to hygiene, but like,
How do I balance?
how do I balance my, yeah.
Okay, so first of all, it would be good to see a gyna to see whether your hormones are imbalanced or not. There are people who think they're imbalanced and they're actually absolutely not. So what symptoms are you having that are making you think that your hormones are imbalanced? That's one thing. The other thing is that once your gynecologist tells you that truly they are imbalanced, then they should ideally provide treatment for you. But if you're not looking to go the medical way, ideally I'd say a healthy diet, weight loss really balances hormones. Like people who are overweight tend to have more hormonal imbalance, more menstrual irregularities, more difficulty with fertility than people who are in the correct BMI. So weight loss, diet is very important. Eat healthy, avoid alcohol, drugs, smoking. That's a very good way to balance your hormones. Get enough sleep, avoid stress. Things like that I would say would really be able to balance your hormones. Weight loss is extremely effective in hormonal balance, but I would say, see whether you even have it in the first place.
Okay. I have the last question. I saw, but it was in line with like contraceptives, but let me just like air it, because I saw it on Claire's Twitter, and she said she found out that women who smoke are usually not supposed to be on contraception. That's what
Pills or
on
something.
did she say pills?
I
or
can't
did she
remember,
say,
but I saw that.
yeah. So is it true?
Well,
Tobacco, cigarettes.
I wouldn't really say so. The reason why that might have come up is because oral contraceptive pills, when taken over a long period of time, they do lower your immunity, and so does smoking. So basically now you have two things that are lowering your immunity. I wouldn't say it's a categorical no. When we check a patient's medical eligibility criteria, we're really looking at diseases, all right? We're looking at heart disease, hypertension, diabetes, HIV, we're looking at diseases. Now if a patient is a smoker, that's basically you're telling all smokers that they can't have contraception, right? So I don't think it's a hard and fast rule. However, women should know that if you're smoking, it significantly lowers your immunity and predisposes you to cancer. And if you are taking an oral contraceptive pill, that is lowering your immunity again. So you might have your immunity crashing and you're getting lots of infections. So you really need to look into whether you want to take an oral contraceptive pill or something else. If the only thing that works for you is an oral contraceptive pill, then the benefit outweighs the risk, and so you can go ahead and take it. but it's not like, you know, categorically contraindicated for women who smoke to take oral contraceptive pills.
Okay.
Okay, so that's it for today, guys. I hope you've learned so much. Thank you, Dr. Sule, for joining us and informing us about all these things. Dr. Sule also has a 50% off on pap smears at her clinic. You can check out her page. We'll put the details under the video, and you can check out the details. Yeah, so that's it for today. Remember to like, share, and subscribe. See you next time.
Bye.